Okay, tonight we have our public hearings on the 2021 proposed budgets, and we're going to begin with our departments. First we have on here is Clerk Rachel East. Everybody come forward and you can remove your mask, I guess, while you talk.
Okay, bear with me, I'm new at this and kind of really don't know exactly what I'm doing, but for the clerk's budget, basically what I'm here to ask you guys just to think about and consider, we did have a full-time person, and when we lost that full-time, have a part-time, Mandy had left and I took over, and then my part-time person came to full-time, so now I have no part-time person. And we did put it out there, we posted the job. I have no prospects yet, and which I haven't been too gung-ho on it because we don't have a working computer. And without a working computer, I can't really train anybody in. But I'm getting to the point where I'm desperate, and as soon as I have a working computer, I'm going to have somebody. So I'm just proposing, I'm happy with the part-time. I'm not gonna ask for a full-time person, even though I would love that, and if you guys would consider it, yes. But for a part-time person, if you would just consider possibly some incentive, some benefit, and just an example, maybe some paid holidays. Not every holiday that we have, but maybe a select few, just some kind of incentive that we can maybe get somebody that, I don't know, just gets them excited to maybe work out here, because we do have good hours and we have a good staff, and I really need an extra person, and just something to think about for our next meeting next week. And the only other thing I have is our postage, and I know I requested quite a bit, but I just pulled out the last of my postage, and it's not going to get me through this general election. So I'm going to really struggle in that department. I mean, I can probably come down some, but I just want you to consider not cutting from that a whole terribly lot. And we don't have the election next year, so hopefully that will help. But other than that, that's all I have. Is that all I do?
Yeah.
Okay, thank you.
Thank you.
Thank you.
Okay, next we have Warren Taylor with the coroner's office.
Okay, I've got some papers I want to give everybody real quick. I kind of broke down over the last 5 years what has been done in the coroner's budget as far as each year, and half of the categories has been cut every year, and I know you have to make cuts this year, but at the same time, I request that maybe you take a look at the cuts that's been made in the past and see if we can change some of them. And starting out with the deputies, I did not ask for an increase for myself next year for salary, but I did ask for an increase for the deputies, plus I requested one more deputy. All my people are classified as part-time, but at the same time we work holidays and weekends. We don't have the option just to close up on a holiday. And a lot of people doesn't realize that the deputy coroners are making, and it depends anywhere from $1.58 to $1.62 an hour when they're on call. And that's on their regular schedule. Most of the time we try to have a second deputy go with one on call, because it's a lot easier as far as when they go out on call, have help. Sometimes we have help with the ambulance service, sometimes with the police department. So they've been times this year they've been just one of us going out on call, and trying to remove a body just with one person, it's kind of a disgrace to ask family members to help place the person in a body bag and help transport it. So that's my main concern. I've asked for that one extra deputy, which The one extra deputy would actually bring the base salary per hour up to about $1.95 an hour. Not much of a raise, but still, it would help. Office supplies, due to the COVID this year, our paperwork has kind of increased, and I've asked for additional money in office supplies. Digital camera supplies, the paper in orange is what it has been previously. That was higher. It was cut last year to $50. I asked for an additional $25 for next year to make it $75. Sample collection equipment, same way. 2016 to 2018, it was $250. It was cut in last year to only $50. I asked for $200 for next year. Cadaver bags, I did not change the price on it because I feel that I've got enough bags that we should be in good shape for the rest of this year and probably next year, so I did not ask for anything there. Decomp equipment, I looked at the previous 5 years, the first 3 years, 16 to 18. I just asked for the same amount that we was getting back then. Uniform allowance, I did not change. Cleaning and sanitation supplies. There's not been anything in that budget for 5 years. And I found out that if a budget item is not used for 2 years, it is deactivated. I asked for that to be reactivated because we need cleaning supplies. And next council meeting, I'm asking for a transfer into that category to cover the rest of this year. Computer and software, that's an area that we discussed before. I've asked for $1,000 for a computer. If we can get the IT guy to get everything done here with the auditor's computers, and then I wouldn't have to worry about that, you know, because he said he had done it. This has been going on 4 months now, and I'm still trying to use a computer that is obsolete. So now the other services, the Corners Association dues, I actually decreased that to what it just covered for myself and the 4 deputies I got now. I didn't ask for an increase there. Training, again, I went back to what, and I didn't mark that one in orange, but 2016 to 2018, we had $700 a year for training. It was cut last 2 years to $500, and I'm asking for that to be increased back to $700. Lab and x-ray fees, I didn't change that. I left that the same. Autopsy fees, I left that the same. Morgue fees, again, it was cut the last 2 years. I'm asking for $300 for next year. Postage, this year I had $25, and I think right now I might have $3 left in postage, so I asked for an increase, $50 for that. Travel and expense, I asked for $400. The reason being on a travel and expense, once this year I had to take a COVID sample to the State Board of Health, and when I turned in my mileage, it was $133.40, and there's only $100 in that budget. So one trip to Indianapolis depleted the whole budget. So we need to look at that. Hopefully next year this county will have an extra vehicle at our disposal for training, or whoever in the county can use it. Telephone. The AT&T charges, let's see, they charge $44 a month. Then PSC charges a fee that we don't know from each month to the next what the fee's going to be. And I just averaged that PSC for $6 per month. 1 month this year it was $13 and something. It's been $5, it's been $4. It varies, depends on what kind of phone calls I have to make. So I'm asking for that to be increased to $600 over $540. Cooler maintenance, that's another one we have never had before, but with the new cooler that we got, sooner or later we're gonna have to do maintenance on it, and I asked for $400 there. Vehicle repair, I put in for $800, but right now with us getting a new vehicle, I can see where we're not gonna need that kind of money for vehicle repair, because hopefully the new one will be under warranty for a few years. The only thing we might need is windshield washer solvent, some minor stuff there. I didn't ask for anything for mileage and autopsies or conveyance fees, either one. But I did ask for, in the budget, I asked for additional appropriations for, like I say, another deputy. I asked for a vehicle, and I asked for a computer, which the computer and vehicle, I think it's been taken care of. Hopefully it's been taken care of, so we don't have to worry about that. And the cleaning supplies, that I've added for next year, but I'm transferring money next week into that budget already. And I just want to bring up that part-time people at the jail is making $10 to $12 an hour compared to mine making $1.58 to $1.62. And I'd just like to see it, a pay raise for the ones I got and one additional. And thank you.
Okay, thanks, Warren. Okay, next we have County Extension. Kathy?
She's coming.
Hi.
Ready?
Yeah.
Okay. Well, first of all, I want to start out by thanking you all for what you've done for us for the 2020 budget, especially having a summer employee. That turned out to be a real lifesaver because we never anticipated all that we might need to do. As you may or may not be aware, we did continue to do programming, including county fair. We just did it in a virtual format. That presented a number of challenges by going virtual, but I think in the end, it was the best that it could be, and it gave the kids an opportunity to show what they had learned and what they had accomplished. And actually, in some ways, by having a virtual fair, people who live way far away and wouldn't have been able to see what they did could log in. So if you haven't been to our website and seen that, I would encourage you to check it out. So some of the things that we've done in the last few months that we never anticipated doing was rapidly assessing the needs and responding to the needs in a very different way. So we've created educational videos for classroom use. We've shared many of the resources that were happening statewide and nationally were now being available to our local folks that wouldn't have been otherwise. So that was one benefit that we had. Going forward, we will probably offer our programs in multiple formats, depending on what the conditions are. And we're even thinking some of our winter programs, post-pandemic, might be offered in a virtual format because when weather gets bad, it won't be a travel problem. But we're already back to offering some in-person programs as local people are willing to come and participate in. So the handout I gave you just gave an overview of some of the things that we've done in the last 6 months. I wanted to keep it short, so it's just 2 pages, but that gives you a brief overview. So some of our budget implications. Staffing is our most critical need. So I know the budgets are tight, and sometimes you have to make hard decisions, but I ask that you fully fund our Purdue extension contract, which has no increase from last year, and our one support staff person, and then if at all possible, our summer employee. Those are most critical. So as I go through the budget, it was really tough to put together because we don't know what 2021 is going to look like. So for example, mileage. Mileage use was way down for 2020, and we don't waste money. So if we don't need it, we don't use it. But it's hard to anticipate what 21 is going to look like. So I was looking very optimistically that we'll be back to being able to do things more like we did in 2019. In addition, some of the good things that were added during the pandemic. So if we're back to traveling in 2021, that's what we'll need, in spite of the fact that we didn't spend near all of mileage and county car use for 2020. Likewise, some of our other line items are down a little bit. For example, we don't have to print as much paper when we're doing virtual programs. So that, I again expect to normalize a bit in the future. 4-H continues to be very active and involving youth and getting youth the experiences that they need in terms of leadership. And probably the best thing we do is engage them in things that are going on in the community to make them see the benefits. And one of the things that I love about our young people today is they want to help others. So the handout kind of highlights some of the things that they did during the pandemic to respond in a responsible way, keeping themselves safe and the people they serve. So they are continuing to do that. That's just a snapshot of where we are right now, not where we'll be by the end of the year. So 4-H continues to need your support. Extension continues to need your support, and we're here to help the public in any way that we can. And if you have any questions for us or for what we're doing, I'm happy to answer them.
I would like to thank you for facilitating our county council meetings during the pandemic and until we were able to face-to-face again, because with the digital, that really helped us, a lot, but.
You're quite welcome. That's not something that's normally in our list of things that we do, but that's an example of how we
Right.
try to respond when there's a need. So likewise, there may be a need in the future that you've never thought of Purdue Extension doing. Reach out to us, and if the ones of us in the local office can't do it, if we've got connections with people on campus, we'll try to get it done for you.
Thank you.
Thank
All right,
you.
Thank you.
Thank you.
Okay, next we have the Veterans Service Office. Kevin?
Good evening.
Good evening.
I'm Kevin Hurt, Perry County Veteran Service Officer. I'd like to start out by saying thank you for appointing me to this position last month. It's a great honor helping veterans, and it's something I'm very passionate about. I'm very grateful to be a part of, and I'm very grateful to be a part of. As of 2019, the veteran population in Perry County was 1,287 veterans. Veterans in this community bring in $7.6 million of revenue to our community from their compensation and pension. That's money spent within our community at local businesses, mortgages, utilities, etc. With my outreach in this community that I have already started with using Facebook and creating a group called Veterans of Perry County, Indiana, I have, as of today, 376 members that I can get information to about benefit and community events. Will increase that revenue that comes in our community. I have upgraded the process to submit VA claims in the county to a program called VetraSpec. VetraSpec is a database that costs $599 for initial setup, plus $449 per user. Then each year it costs $449 per person. That usually is paid by the county, but we have the state of Indiana paying that bill for us. Now that VetraSpec and the capability to digitally sign documents, I will no longer have to print these documents, fax these documents, or mail these documents, which is another savings we will have in this county, not have to use paper, ink cartridges, envelopes, and postages. I recently set up a workstation in my office with a laptop that has a built-in webcam and a microphone. So veterans that do not have internet access or are unable to travel far distances, the opportunity to come here and do their appointments virtually. Since COVID and the VA has really made a push to make more doctor appointments virtual, and with the success the VA is seeing with this, I would say this is going to end up being something that's going to be very popular in the veteran community, especially with our elderly vets. Now there will be appointments that cannot be virtual, so that's when we will set up transportation for those veterans to get to their doctor's appointments. Right now the DAV has suspended all transportation with the volunteer services due to COVID, but at the Louisville VA, they have DTS transportation that's separate from the DAV, and they are providing services and will drive here and transport veterans to their doctor's appointments. Once DAV allows us to start transporting patients, I will have that van going to Louisville VA facilities, and I will also start having patients transport to Orangeboro and Evansville VA clinics as well, which is something that hasn't been an option for veterans in this county before I took this position. I am actively pursuing another option for our veterans, to receive care within our community through Perry County Memorial using VA healthcare. With how advanced VA healthcare has gotten with their community outreach or community care program, sending veterans to hospitals outside of the VA, I don't see why we can't make this happen. I am trying to coordinate between Perry County Memorial and VA healthcare to see if this is an option. If I can make this work, it would not only benefit and protect the veteran from the spread of COVID, but it would generate money for our county hospital, and most importantly, keep our community veterans from going outside of our community and being in populated cities where COVID is very active. Right now, Perry County Memorial is not in the VA network to be able to make this an option. But I have the forms that need to be filled out to make Perry County Memorial part of VA's network and open up this option for our veterans. I will be emailing Brian Herwig at Perry County Memorial Hospital and hopefully set up a future appointment with him to go over this option and see if we can open this door. With all this being said, here as you can tell, I hit the ground running, and I am making the services for veterans in this community broader than they have been in the past years. I took this job with the hope that we can make this office full-time. I need to be available 5 days a week for our veterans. With the virtual appointment workstation active, that alone needs to be available 5 days a week to service our veterans. Once DAV allows us the van to start traveling once again, I will have the van running 5 days a week, and it will be traveling to the Louisville VA clinics and to the Evansville and Orangeboro clinics. I also need to be available for our veterans to help federal benefit related issues and state level benefit issues. My office approves tax deductions for those veterans that qualify on their property taxes. Also, I can approve disabled veterans license plates for those veterans that qualify. Those services need to be available 5 days a week as well. So what I am asking is please approve my office to go back to full-time position, so not only can I serve our veterans 5 days a week, but at the same time it gives me the opportunity to build my future with retirement and gives me the benefit of being a full-time employee, which I feel is deserving to myself and also to the veterans of our community by letting them know our community supports veterans by having a full-time service officer. Thank you for your time, and again, thank you for having confidence in me and taking care of our local heroes.
Thanks, Kevin.
I'd like to welcome Kevin to the position. I've been to that office twice. I've seen what he has to offer, and what he is proposing I think is justifiable, and I'd like to see the council approve that move.
Okay, next we have the election board. Rachel?
I don't really have anything more to say on the election or anything. There is one thing I want to point out on what I was stating previously that I was just nervous and forgot to mention. It was brought to my attention that our part-time person that we had, before Mandy left, she was getting paid at $14.91. But it was brought to my attention that all other part-time employees were not getting that amount. And of course, I wanted to be fair, so I was all for, being on the same page with all other part-time employees too. So I did make that contribution, so just another maybe reason just to kind of help out with some benefits, and not just benefits to part-time people, just for my office, benefits to all part-time people, if it could just be a consolidated thing for everyone and everything's fair and whatnot. So I just wanted to add that. Other than that, I have nothing for the election. I'm good.
Okay.
Thank you.
Thank you. Okay, our next is commissioners. Tom, or
I'm just basically here for, if you got any questions. I mean, I don't want to go through the
okay,
line by line.
that's fine.
Yeah, 'cause there's, we'd be here all night.
Property reassessment, Mindy Lasseling.
The only thing I have in the property reassessment that I've changed from previous years outside of the contract is you'll see XUP CAMA, which is a new program. This is, last year we were scrambling with the state doing away with the state sales disclosure program, as well as Thomson Reuters eliminating the business personal property program. So we were behind the gun trying to get a program, get it implemented. And XSoft, we still currently have Thomson Reuters through the CAMA system. I proposed to switch to XSoft. I just learned last week that Thomson Reuters' top IT guy, Chris Sager, that was our total contract, he's gone to XSoft. So I really am concerned that Thomson Reuters is probably going to eliminate their CAMA system. So I'm trying to be proactive rather than reactive. This amount is a 5-year contract. I've put that in reassessment. Maybe we could look at splitting that through QMCAP or something. But I just really am concerned about the CAMA system, which is the guts of the assessment system that rose values to the auditors, that equates to our property taxes to get income in for the county. And if we are down, the system could really hamper our reassessment process. So that's the only change that I had on there. So if anybody has any questions about the XSoft program.
Not really.
Okay, thank you.
Thank you. Clerk, should I do
Yeah.
Markham?
Yes, he
Okay.
came up here.
Next, we'll do health, Dr. Markham.
I'm here as county health officer, and I want to address the salary of our current health nurses. I hope all of you saw the couple of articles that were in Perry County News talking about the job that Sarah and Tara have been doing. We have two of the, in my opinion, the hardest working, most dedicated nurses that anybody could ask for. Currently, Sarah's salary is just over $39,000 and Tara's is about $33,400. Having checked at nearby counties, Spencer County's two nurses are paid $49,000 a year. DuBois County, $50,000. Gibson County, $48,000, and Posey County, $45,000. We are way behind our comparable counties. Also doing a little bit of research. Either of these nurses could very easily take a position at the hospital, one of the home health agencies, one of the nursing homes, and make a lot more money, and we could not afford to train 2 people to take their place. So we have requested an increase in their salary, and I am pleading with you to pay these ladies what they deserve. That's all I have to say, and I'll be happy to take any questions.
I do. Doc, could we get a copy of that?
Yeah.
Those amounts?
All right.
So that we can look at next week?
Yeah, I will, I'll just give this to Pam, and
Fine.
she can make, I only made 1 copy for
Okay.
me, so I'll.
I can make copies. I'll run it in the office. if you
Okay.
want me to.
All
Do
right.
you know if the other counties have RNs, LPNs?
That I do not know
Yeah,
for sure.
just-
I mean, either way, I mean, Sarah is an RN.
Sarah's an
and
RN, yeah, I
is,
know.
she's anywhere from $6,000 to $11,000 a year less than people doing a comparable job, so. And I apologize for not knowing if they have LPNs or RNs, but either way,
Yeah.
Sarah is well behind her compatriots doing the same job. Any other questions?
Brian.
Yeah,
Oh, Brian.
Brian.
I'm Brian Herwig from the hospital. I sit on the health department board, and I fully support that. And I'm surprised at how little they're paid. And I think I just support that, and they can get those dollars anywhere quickly. So I think that's a good move. Certainly in light of what they've done this year, but we need to keep them in that role. So I support that.
Anybody else?
No.
All right.
Thank you.
I will give this to her, and then she can make copies for all of you. Okay?
Thank you.
Thank you for your time.
Okay, next we have the clerk's record perpetuation, Rachel East. Is she gone?
She's gone.
Okay. Highway, Steve Howell.
Okay, our Cuban Bridge budget is, one we're submitting the same as it was last year.
Okay, wait a minute,
Where
now
you at?
Steve. Okay, so you wanted to talk about Cume Bridge too?
Yeah.
Okay.
Okay. Okay, so let's
Go
catch
ahead.
up here where they're at.
Local road and street, we don't have any changes on that one from last year. On our restricted, we've got this regular budget and the restricted now with this, all these rules. We do have some changes on that. On our salaries, the wages, part of that percentage comes out of restricted, part of it out of the regular MVH fund. So that changes every year. The percentage, we take a certain percentage out of each one, and depending on what we do during the year, some things qualify and some don't, so some have to come out of regular MVH and some restricted. On our road signs, we are asking for $5,000 instead of $3,000. DOT, well, NDOT came up with this, from our bridge inspections, they had to do those load ratings. So we had 28 bridges, I think it was, that we had to add additional signs to, we didn't know anything about, that we was gonna have to do, so we are out of bridge, or out of sign money, so we asked for an increase in that of $2,000. I think that's the only changes to that one. Regular MVH fund, on travel, we went down to $500 on that decreased that from $978. Printing and advertising, we decreased that to $100 from $300. I believe that's the only changes in that budget. And then the other, well, this is MVH also, 531, maintenance and repair. Hardware and tools, we decreased it $1,000. Steel, we took, went from 1,000 to 500. Concrete, we went from 2,000 to 1,000. Salt, we went from 25,000 to 23,000. We've got our building full of salt right now, and I hope we have another winter, just like the last one was. Seed, we took it down to $50 from 100. Now DOT or CDL testing, we had to increase that. DOT has changed the rules on that. They have to do more testing than what they previously did. We have to test more people more often. We also have to run a check on each driver every year. I've been told it's gonna be $90 per person to run that check to see, check their driving record. This is all stuff that we have never had to do before. Our safety training went from 500 to 300. Equipment rental, 5,000, 4,000. Solid waste disposal, we cut that from 2,000 to 1,800. That's the only changes in that budget. Motor vehicle highway, general and undistributed. Office supplies, we cut from 1,000 to 800. Gas and oil is up in this budget, but it's down in the other one. We take a percentage, the restricted and non-restricted again. So we're taking a bigger percentage out of this one this time, next year. And on our equipment lease, there's a $100 decrease. My understanding was that there was a $100 charge the first year for paperwork. And last year we didn't know that, so we can decrease it $100. In the surplus, sir, and wheel tax, we have 50,000 in there in bituminous. We have 50,000 for new road equipment, and we've got 150,000 in there for insurance. That's 250,000 total on that. We're taking part of the health insurance out of that budget this time. We need to make more cuts than what we thought we could in highway, so we're taking out there, which we're allowed to do that. And we also got 120,000 from Hume Bridge back into highway for bridge work and culvert work that we've done. We used to do that every year. I don't think we did have it last year, but that's something we used to do every year.
Under your highway restricted maintenance and repair, did you touch on that? That was decreased by over 200,000?
We didn't put any bituminous in that.
Is that what it was?
Yes. Usually put 200,000 or 300,000 in bituminous.
Okay, well, that's why it's the
With the
difference.
community crossings, they didn't have a call in July, and they told me they hope to have one in January. And we hope to, we'll apply for that if they do, but if they don't, we haven't spent any of our edit funds yet. If they don't have a call, then we will be able to do some paving next year with that edit money, so we didn't put any in because of that. And also, we've got over 100,000 left in community crossings because of the COVID thing. The oil prices have dropped, so our share was over 100,000 less than what we had anticipated being.
So you get to keep that?
Yeah. I don't know if we can spend it if we get to keep it. Don't know if we can get out of that fund until we have another community crossing. That's something I gotta find out.
That's probably what'll happen.
Yeah.
Excellent.
Well, that's good, I guess.
Okay, thank you.
Thank you.
Thank you, Steve.
Okay, we go on to the next sheet, I guess. There's no one else on there. Is anyone else here walk in later?
You might ask us, anybody else in here for any departments?
Is there any other department, courthouse department in here that hasn't spoken? If not, we'll begin with our other agencies. We have Becky Guthrie with Ride Solutions.
Hello.
Hi.
Been around many years. Just back to thank you for getting our increase back last year. It meant a lot to us, and it shows your support. Public transportation for us is very, very important in every county. And we have been fortunate enough to be here now 10 years. And we have done a lot of rides. We've taken a lot of people, a lot of places that they could not have gone before it would be for us. During the pandemic, of course, rides fell all over all the county region, but we were considered essential services, so we did keep up. We mounted plastic barriers in a lot of the vehicles that were close quarters. We have got a lot of we have masks that we give to all passengers when they get on. If they don't have one on them, a lot of people just, misplace them. We have tried to carry on, and our drivers have been super about knowing the need. They put the need of the people before they get to, they're not selfish in any way. They realize a lot that these people have to go to dialysis, they have to go to doctor's appointments, they have to, and the link between the nursing home people is one of the saddest parts, because they don't allow visitors now in the nursing homes, and we were taking people to visit their loved ones there. So hopefully that will resume soon. But I want just to, we lowered our prices. Our rates were 3, 5, and 7 for trips, and we put them back down to 2, 4, and 6, which was originally what we started out with, just to help people that do need these trips, make it a little bit more affordable for them during this time. And we've had some, of course, good feedback from that. So I just was wanting to let you know that we appreciate your support. We're glad we're in Perry County. We have all the counties linked together down here now, where people can go across county to county. And without your support, we would not be here. So, do you have any questions?
Thank you.
Thank you very much.
And next we have Jim Childers and Brian Herwig with Perry County Memorial Hospital.
You need to go to page 25 and page 56.
Hi.
My name is Jim Childers, and I'm the Chief Financial Officer for Perry County Memorial Hospital. And I'm pleased to be here to talk to you about in this case, the EMS budget that Perry County Memorial Hospital has developed, and that we run the program. And you've seen the budget. There is an increase in in what we think the county needs to support going into next year. We will be submitting our August financials that are just getting finished, but after 8 months, we have now gone over the amount of the subsidy that was provided for us for the 2020 year. That was set at $185,000. We're at $191,000 right now through the end of August. Rents are still not there, even during this month. Further after the serious COVID months that we had. We are also starting to see in the last couple of months even more bad debts coming from the EMS runs that we have, that they aren't paying the payments that we're expecting. We also did try, and we're only partially successful to build a non-transport bills. Only Medicaid will pay toward that. We get about $76 for each of those runs. We were able to recover year-to-date only about $7,000. So we have a lot of unallowed charges that have been driving up our contractual and our deductions that we're projecting into next year as well. Our expenses for next year look like they're going to be level, if not just slightly over where we expect to finish 12 months 2020. Those expenses and salaries, we've done some things this year, including we've boosted the EMS salaries. But we've also got some assumptions that we're making for next year about how we can reduce the amount of overtime and increase the staffing to cover more hours and cover them at a less cost for us. That's all going to be built into the budget for 2021. Benefits for us are, in the budget, are at 27%. They actually run a little higher, but at this point, we're just projecting 27%. And then all the other expenses down there, with only the exception of drugs, which we think comes from what the pharmacist and EMS is telling us about the increased cost of what they're using. We increased that line item, but the other line items are fairly flat with this year to next year. Altogether, the loss that we're expecting for this year will certainly be more than $191,000. And where we're not necessarily looking for any more subsidy in the 2020 year, we think that, along with the reimbursement implications that I've discussed, and us trying to manage our expenses, and fewer runs that we're projecting for next year. We're just not seeing the same amount of runs. And that's all causing us to see that that the number you're seeing in front of you is the request we need for support from the county to continue to run the program. I'd be happy to answer any questions now or any time about this report.
We'll do what we can. You know, we're facing with, like, what is it, in excess of $900,000 that we're going to be cutting. So, you know, we'll do what we can.
Yeah, we appreciate that, and we can talk with you more as need be if you have any further questions.
Okay.
Okay, thank you very much.
Thank you.
Thank you.
We did Warren Taylor. Okay, Perry County Fairgrounds Committee, Kylie Schroeder and Sarah Hebert.
You're back to 24 and 25.
Hello everyone, we want to thank you all first for your continued support of the Perry County 4-H Fairgrounds Committee and our facility. 2020 has definitely been a trying year. I know for everyone that was not able to handle, or same way with our Fairgrounds Committee. As most of you know, we were unable to host our 4-H Fair this year, which is a large event for our facility and brings in sponsorship and also a lot of revenue. We've had several events that normally bring in revenue also have to be canceled due to the pandemic. So this year, especially more than years past, we're asking for your support to help continue to fund our facility. We still have grounds maintenance, we still have bills that need to be paid, and due to the pandemic, with the lack of revenue that we've been able to generate due to canceled events, we're struggling, doing everything we can to try to make our ends meet to keep our facility up and going and not let it slip.
Along with our events that have been canceled, we've also had our rentals been canceled, so that's another revenue that we get money to pay our bills too. Due to COVID, we weren't allowed to have any rentals, so that is another way that we get money for our bills, and that has been canceled also. So any help would be greatly appreciated.
As a committee, we've worked hard to work around our budget to try to make things work. We've used the summer assistant with the extension program to help mow our grass to eliminate that cost, to reduce that cost. But now the summer assistant program is completed, so we're working to try in any way possible to help ourselves. But we just ask for your all's continued support to help fund our facility and our program.
Thank you.
Thank you.
COVID has affected everybody. It's going to affect us too with our revenue that we'll be collecting in 2021 and especially in 2022. Next we have SERS, Cheryl Mills and Melissa. Is it Melissa?
Page 23.
I'm Cheryl, I'm the Vice President of Community Services at SERS, and this is Melissa Sharp, she's our Vice President of Finance. She's got a packet of information with the details of our request, but I'll just make it short and sweet for you and hit a few bullet points. First of all, I want to personally thank you for your continued support. The financial support that you've provided us over the years has helped support the 58 adult consumers with disabilities engage in community services programs, the 43 children who receive pediatric services, and the 660 passengers who we've provided transportation services to over the past year. Additionally, we've been able to increase wages for our direct support professionals. That helps us maintain consistency for our consumers. In fact, we've had an 85% staff retention rate, while industry-wide it's at 60%. So that's increasing. That has helped us maintain staff. So in the upcoming year, we'd like to expand our day services program at our Tell City location. We currently only operate 2 days a week. We'd like to expand that to 4 days a week and potentially extend the hours into the evenings to accommodate people who have loved ones that work into the evening hours. Of course, that would come with additional expenses, and your contribution would certainly help with that. And so that's just kind of community services in a nutshell and what we would do with your continued support. And I'll let Melissa talk a little bit about the financial perspective.
Cheryl talked a little bit about our staff wage increase. Related to that, throughout the pandemic, we chose to maintain payroll. As you can imagine, a lot of families didn't want their loved ones going out into the communities, which is what we do a lot with. Those staff also lost hours because we wanted to keep them on as staff. We didn't want to risk losing them. We chose to continue to pay all of our staff their average hours. We did that beginning of April, and we continued that through the month of June. In addition, all of our workers who work directly with the public or work directly with the consumer received what we termed as hero hazard pay, an extra $1 per hour. We currently continue that on weekends. We're not doing that during the week currently, but for weekend hours. Also related to the pandemic, we purchased more than $15,000 in PPE supplies, and in doing so, we're able to supply all of our staff for every shift that they work a surgical mask. They don't have to worry about that. And although we lost more than $220,000 in revenues just in April and May, we continue to do all of those things. That additional expense, payroll expense, totaled about $95,000 for us. At our Tell City location, we provide reduced cost space to the Perry County Child Care. This year, again, due to COVID, they started a summer school-age program for children. They ran out of space, so we donated our conference room for them to use. At our Troy facility, we partner with the Southwest Indiana Child Advocacy Coalition, and we provide them with 1,100 square feet of space for free. So your contribution to us, in turn, we also contribute to other organizations. Lastly, during the calendar year of 2019, SERS infused over $850,000 in payroll and purchases into the Perry County area. Both team members and consumers in Perry County are very active in the community. Many of our staff are volunteer in local organizations and at the state level. So there's additional information in your packet. If you have any questions, we would love to answer those. Otherwise, we very much appreciate your support.
Thank you.
Thank you.
Thank you.
Thanks.
Okay, next we have Jesse Watkins with Perry County Council on Aging.
Page 25.
Again, just like everybody else, I want to thank you all for your support of the Council on Aging. It seems like 2019 was a very difficult year for our organization. 2020, I won't say it's been difficult, but it's been a challenge. COVID, just like with everybody else, that has really been no 2 days alike. Everything's been a learning process, and I'm glad for the opportunity to have learned the things that we've learned thus far through COVID. Just since the last time we all spoke, since the last budget, we've added 2 vehicles to our fleet, bringing us to a total of 5, with the eldest vehicle being a 2013 that still has plenty of wear and tear, plenty of miles on it. And even though we have received the NDOT funding already to purchase a 6th vehicle in 2021, we don't know that we will do that. If we can make it happen with what we have, just for the sake of sparing 20% of the cost of that vehicle, we will carry through one more year with a total of 5 vehicles. From this time last year, and excuse me, I don't remember exactly all of the information I sent you all in June, but just from last year, we have increased our number of trips as far as a transportation provider, but that being the major project for our organization in 2020. We've gone from doing about an average of 100 or so trips a month to doing very easily some weeks that many. So many months our total trips have totaled an average of 95 or better per week. So we're looking at 300 to 400 trips per month, and we are transporting people who either could not utilize the service with Ride Solutions or Lincoln Go, they couldn't afford a cab, or they needed a wheelchair vehicle. All 5 of our vehicles are ADA accessible. They'll all hold at least 1 wheelchair, with the newest holding 2 wheelchairs up to a 38-inch width capacity. And we're told by NDOT that we're the only provider, Section 5310 in the state of Indiana, that has that. So we're very proud of that. We've grown over the course of the last year also, from having about 3 drivers. We have a staff of 8 drivers. We've employed a part-time administrative assistant, and then of course I remain full-time as the executive director. Our drivers also received a pay increase over the course of last year to be competitive with other providers that are providing the same transportation service. We brought them up from $8.50 to $10.50 after 90 days of service. 10 even, excuse me. I get those 50s. I hear 50 and I get excited sometimes. 50 cents will make you go wild. But we've got a good crew of people that care about what we do. We're providing over 90% of the transportation to either one of the local nursing facilities. We're working with Life Springs Health Systems very actively to do 4 runs, which turns into 8 runs when you measure one-way trips. For their clients, for their CRC program every week. In addition to that, we have worked, I've spoken with Kevin, I've spoken with different ones, and we're working with the Perry County Memorial Hospital even to do hospital discharges. A lot of those come in late in the day, a lot of those are unprepared, unplanned for, but fortunately we've got a good team that'll make sure that our people are taken care of. I say this to Southeast Trans, one of the Medicaid brokers. I've said it to Logisticare in conversations recently, as well as WellTrans. There's nobody that can take care of our clients in this county any better than we can. We know our clients, we know their needs. I was born and raised in Cannleton. I could tell you, without giving you an exact address, you go up here, you hang a right, 3rd house on the left, you know, whatever. That means something here in Perry County. It doesn't mean anything in Atlanta. It doesn't mean very much in Indianapolis. But here in Perry County, it means something. A lot of times we find that other providers send drivers and vehicles from out of county, out of area. They're not familiar with our people. They're not familiar with our streets. They're not familiar with our circumstances here, but we are. We're from here. We live here. You know, I lived here most of my life. Our people work here, and we get to know our clients. In addition to transportation, we have really pushed resource referral this year. Our phone rings at least 30 times a week. Somebody needs homemaking service. They need a little bit of housework. They need somebody to run errands. So we can connect people with that. And we're looking at 2020 into expanding into homemaking service is what it's called. Along with that, we're looking at increasing senior services, or actually resuming those where they have been previously suspended last October, when that was brought to the council's and the commissioner's attention that we had closed the senior center in October of last year. We have been meeting and planning and working on a solid plan, a comprehensive plan to deliver evidence-based fitness programs, nutrition programs, educational pieces, fraud prevention, state health insurance assistance program enrollment, SWRCA enrollment. I was on the phone today with AARP to provide free tax preparation to people 55 and older in our county free of charge. RSVP, we've partnered with them to be a volunteer station for these things that are coming up. We had a solid plan for 2020. COVID had a different plan. 2021, we still have a solid plan, and it's even bigger than what 2020's was. We were very fortunate for your support of $26,000 last year. I've come to you with a request of $30,000 for the coming year. As you can see, we have big plans. I also realize that you have big cuts. We're grateful for whatever you can do to help us continue to do what we do for the people of this community. And without the county's support, we couldn't do even probably a fraction of what we do. But we've grown as an organization, we've grown as a community over the course of the last year, and we just appreciate what you've done to help us, and we look forward to 2021 and what it holds. Do you have any questions for me? Thank you all.
Thank you.
Thank you.
Okay, next we have Brenda Powers with William Tell Senior Citizens. And Donna.
Thank you. I'm Brenda Powers, and
24.
I'm here for the William Tell Senior Citizens. I ask for your support. We don't get anything right now. We never have, and I've often wondered why we didn't get any county support. But I know right now money's tight, so we'll see what happens. But we're a nonprofit organization, and it's run by a board of directors. We normally serve, before COVID, about 80 to 85 people per week. It's down to like 60 a week now, but it's growing. People are coming back. We were closed for a short time from middle of March, and we opened back up July 11th. And the people are starting to come back. We're doing everything to, stay safe. We're using our, we check temperatures, we have masks, we have sanitizer, we have social distancing as much as possible. We used to have an open kitchen. We closed that off. So we have someone back there serving them. We don't allow anybody back in the kitchen anymore. But everything's working out fine. We're doing good, and people are starting to come back and they're enjoying themselves. We have cards. We have line dancing. We have a monthly meal with bingo once a month. In fact, it's tomorrow at noon. We have Saturday night gatherings with a live band and a meal and snacks and drinks. And we've been doing this since like 1966. Of course, everything's getting more expensive, bands are more, and we can't raise our admission price, so it's pretty hard to keep up. And right now we can't do our fundraisers with the COVID, so that cuts some of our income. So our income is down, but our expenses are still pretty well the same. I think this is about the only place in the county that has any kind of recreational functions for seniors. I think even in the surrounding counties, I hear that, we're about the only ones that do this, especially on a Saturday night with a live band. But, and it's not cheap. A Saturday night runs us a little over $300. And we don't near take that in the door. But we've been trying to keep up. We don't want to close because I think this is something that's important for seniors. Keeps them active, gives them socialization, gives them exercise. It's kind of like a family. And, you know, with families spread out across the country, and we're about the closest people they see sometimes. And, you know, seniors don't eat good by themselves, or they don't want to cook for just themselves. We have a meal. And, you know, they really enjoy it. And they eat good. So they clean me out about every Saturday night. So, but, I mean, no one gets paid at the center. It's all volunteer. Every dollar we take in goes back into the center. So no one's making any money. In fact, sometimes it comes out of my pocket for some of it. But the city helps us. They give us the building. They pay our utilities. But everything else we do, we have to buy our supplies. We pay for our entertainment. And, you know, whatever else we do, our food and all that, snacks, drinks, we got to take care of all that. Of course, like I said, we can't do our fundraisers right now. And I think I pretty well covered just about everything. Of course, our income's down, our expenses are up, just like, you know, everything else, it's getting more expensive. And we just would like to see if maybe the county could help us a little bit on that.
I would like to add one thing, Brenda. We are open to all ages.
Yeah,
It's
anybody
not-
can come in.
It's not just seniors. And we do have young people that come, so, and with their families.
Yeah. I mean, we're not a closed
No.
club or anything. Anybody can come in the door. You can be a member, but you have to be 50 or older, but you don't have to be a member to come in. Anybody younger can come in and enjoy themselves. You know, we don't exclude anyone. And it's nice because we're about the only place in town where you can go and have a good time, family time, without smoke and alcohol.
Do you have a
So-
lot of attendees from outside the county?
We have a lot of people that
I
come
mean-
from outside because they don't have anything like this.
In like, from what, Kentucky?
We have some from Owensboro that come, across the river, Hallsville come. We have some, Spencer County. So, you know, in Ward County, we've had a few. Well, everybody knows Paul H. and he's living in Evansville now, and he comes every now and then. And brings a lady from Rockport. We have some outside people that do come in, but we have a lot of local people too, so. But I think it's something we need to keep. We can't lose it. It's good for the community. We have something for seniors to do. And this is the one thing there is, especially on Saturday night to do.
You know, you talk about charging, what do you charge like for like a Saturday night?
$5. You get a free meal, free drinks, snacks, and you get a live band. But we don't feel like we can raise the price because seniors will say, well, I'm on fixed income, I can't afford it. And we don't want them not to come in. Say, well, I just can't afford $1 or $2 more, so I can't come. We want them to come. We don't want to raise it to where they can't come.
Okay.
So, okay, thank you.
Thank you.
Thank you.
Okay, next we have Pam Hilgenho with the 4-H Council.
25. No, I'm sorry, 20, well, that's
21.
operations. Yeah, premiums and expenses, page 25. Okay.
Hello, I just want to thank you again for your commitment to 4-H, and they are the leaders of our future. And in fact, when I'm finished, I have Meredith Hubert here, who is a 4-H'er that's going to speak with you also. As everybody else, COVID has affected us tremendously. Just so you kind of know the difference between the council and the fairgrounds, the council basically works with the 4-H program, so we're the ones who actually work with the 4-H'ers as far as the projects and and them completing and going to the fair. And so basically, we don't have income from the fair. We only have expenditures. But we did lose our 3 main fundraisers this year, which was a mulch fundraiser, the Schweiterfest food booth, and the auction and pork chop dinner. So all 3 of our fundraisers for this year were canceled. We also, of course, had a virtual fair. We did have 80% of our 4-H kids complete the virtual fair. So I thought that was pretty impressive that those kids valued the fact they wanted to complete, and even though it was a totally different scenario for them. In the virtual fair, we still purchased trophies and ribbons for those kids, and we still had to pay virtual judges. So we didn't gain anything from the fair as far as money, but we did have to put out money for that. Some positive though from COVID is we had a lot of community service from our 4-H clubs and kids. Some of the events that took place, we had 4-H clubs and families picked up trash, donated food to food banks, flowers are donated to the nursing homes, lunch for healthcare workers, county food distribution, and cards were made for the hospital staff. So I think that a positive is that these kids have learned that resilience and going through something different, they can still make a positive impact, and that's what 4-H is about. Just a little bit of note about our 4-H is that we have 87 volunteers, either leaders or people who are on committees, and about 50 hours a year is donated on the average, which if you calculate that, that's about $95,000 of free work that we get from all these volunteers. So, you know, it couldn't be possible without the volunteers, but still we need your support to help the programs that we do. I'm going to pass it over to Meredith, who's going to talk a little bit about her 4-H experience.
So during the COVID, I have done 2 of the social work, and I did planting flowers at the nursing home, and we saw a couple of the senior citizens through the windows. They all seemed pretty happy to see some community members out, and I delivered food to the healthcare workers. They were very thankful for that. I still see them, and they're like, "You were one of the people that helped give food to us." That was awesome. Also, I've done a bunch of trips. This year I did the virtual 4-H roundup, and it wasn't as good as last year, but it was still really fun. I was really thankful that they could still do something. And last year, whenever I went to the actual thing, it was really fun, and I just want a lot of kids to be able to experience what I did.
Thank you. Did you have an auction, livestock auction? How did we do that?
They just basically asked for sponsorship, and they gave the senior members, I think it was like $300. I think there were 6 kids, and it was through sponsorships, and that was through the livestock committee, and they gave just the seniors that money. So I think it was just 6 people.
I guess that was a letter maybe that came out with Sarah Hebert, maybe. I wasn't sure what that was, but I wonder if we even contributed to that. But it was a lot different. I mean, I know we always did, the Republican Party always also did it, you know, spotlight stuff and CNS. And
totally different year, but I think the kids, you know, they learn to adapt, and that's important. That's what leaders do, is they adapt to change, but I think, you know, the program is so crucial for our future leaders, especially if they're going to stay in Perry County.
Yeah.
Hopefully. Pam, I have a question. The increase that you asked for, is there a certain reason why there was an increase this year?
There's Kathy. She'd be the one to answer that.
All right.
Kathy, you're the person to answer that
the
question.
Increase that you've asked, it's like $4,000 more than last year.
Yeah.
Is there a certain reason?
Well, that's typically what, years ago, that's what we got.
Okay.
So, and every year we ask for 10,000. And that covers kids that want to go on trips, leadership
We just
experiences.
didn't give it all.
Usually, we've got more going on at the fair, so it covers more of those kind of things. We're actually anticipating more participation in trips next year because nobody got to go this year. So all the kids that were awarded trips for 2020, we want to offer them to go, but then we got a whole new bunch of kids coming up that'll want to go for 2021. And the trip to Washington DC, where they learn about civic engagement and experience the government, that one alone is almost $2,000. Now, we usually get $1,000 from Farm Bureau that helps with that, but if we have 2 kids that want to go, that's $4,000, and we have $1,000 sponsorship. So that's just one example.
Okay, thank you.
Any other questions?
Thanks.
All right, thank you.
Thank you.
Okay, next we have Christine Beeler with Life Springs Health Systems.
Page 24.
I'm Christina Beeler with Life Spring Health Systems. I'm the new clinical director for Perry Spencer Unit. I just want to thank you for your continued support. We do appreciate it, and I don't want to take up a lot of time. I do just want to mention some of the things the funding is used for at our facility. Last year, we used to be Southern Hills Counseling Center. Last year, we merged with Life Spring Health System. We now serve 11 counties in southern Indiana. And that's really opened our doors. You know, now we have access to our own 30-day inpatient unit for substance use that we can access. We're also planning to extend an intensive outpatient program. Perry County will probably be the start for that as well within the next year. And also, we're the second largest community mental health center now in Indiana. Some of the things the funding goes for, I don't know if you've seen our advertisements. We do have a Facebook page, Life Spring Health Systems. We are offering 5 free sessions to healthcare workers, first responders, and now we've expanded that to teachers as well through COVID. Through COVID, it was really amazing. Within 2 weeks, we were able to switch to telehealth. All our services were telehealth, with the exception of taking care of our chronically mentally ill, and that is where a lot of your funding comes into place. Some of them have insurance that covers our services, some do not. The CRC program that Council on Aging mentioned, we have a day treatment program that a lot of our chronically mentally ill or substance abuse clients attend, so they're with us all day. Sometimes we don't get paid for that through their insurance, but we know they need to be there, we know we need to be taking care of them, so that's what we do. We write off several services a year, taking care of the clients. And through COVID, you know, I can't say enough about our staff. They were out there in the homes, they were taking our clients' food. You know, a lot of times we're the only one the client has. Also, we keep our groups at $15 a group, so that's whether you're private insurance, Medicaid, or whatever. We keep our groups at a minimum. We have a sliding fee scale. We also have a payment plan, and again, we'll write off services if the client can't pay. So that's where some of your funding comes into. And also, you know, we're very involved with the community. We attend monthly DCS meetings. We're part of the child protection team in Perry County, systems of care, trauma response, substance abuse council, and we also work with Perry County Drug Courts. So we're very involved with the community as well. We're also working to become a STAR provider, and what that is, the VA, they obviously have an overflow of veterans needing services. So within the next year, we should be a certified STAR provider and be able to serve a lot of our veterans as well. So do you guys have any questions for me today?
Did a good job.
All right, thank you.
Thank you. Thank you. Next, we have Lisa Gelhausen with Indiana 15.
That's here. Here on this side. Pass this to the side. Use my handouts. Go that way if you don't mind.
Good evening, and my name is Lisa Gelhausen. I'm the Executive Director at Indiana 15 Regional Planning Commission. We're based in Bergman, Indiana, and we serve 6 counties.
And in those 6 counties, we have 6 cities and 21 towns. And we have a staff of 5, and we try to help out our communities with projects that come up from either our board of directors, which we have 43 members, or from meeting with the communities to develop our comprehensive economic development strategy. But the first page shows the 6 counties that participate in EDM 15, and the district receives from each of those counties, we take it by the 2010 population by 56 cents. And you can see that the amounts on the right-hand column. Perry County's is $10,829.28. And that's what it was in 2020, and we would like to keep it the same for 2021. And what that does is it collects $70,000 from the 6 counties. And then we use that and we write a grant to the U.S. Department of Commerce Economic Development Administration, and they match it. And then we can write these grants for cities, towns, and counties in our six county district at no cost. And if it gets funded, then we administer those grants at a cost, but a lot of times those funds are included in the grant application. So I'm going to take you to page 9 in your packet, but the pages in between there show the different amounts through the years, what we've worked on. Page 8. I think I might have said 9. But the projects for 2019, as mentioned earlier, Perry County gave us around $10,000, and the $58,000 is what was brought in from state and federal funds. And what made that up is the EDA planning grant that I talked about. NDOT gives us money to do traffic counts, so you've probably seen some of our traffic counts out on your roads. And then Steve with your highway department gives us a few roads that he'd like to have done, and it helps him with his community crossing applications. And then Cannleton had a planning grant of $20,000 to do a feasibility study on the gymnasium. And then we were also paid, NDOT gave us money to do additional traffic counts. And then we received a planning grant to do a architectural study and what kind of costs to improve the Rome Courthouse. So now for 2020, we expect to get the EDA planning grant again, and we're doing more counts. And additionally, the third one down is the EDA CARES Act. So Indiana 15 received $400,000 from the CARES Act program. And so we're able to work with all 6 counties to create an economic resiliency plan. How do we stay resilient through all these times? And we'll be working with education, industry, businesses. We've written a few COVID relief grants for some businesses to give them money to keep their doors open. And then Cannleton received $192,000 from the COPS program. That's a federal, through the Department of Justice. And so they'll be able to have additional police force. And then EDA Bridge 8.1 and 11.7 in rail improvements. Those are the 2 bridges along Hoosier Southern Railroad. 8.1 is over the Anderson River Bridge. And then the 11.7 is closer to Lamar area. And those 2 bridges, once those 2 are done, then the bridges along the Hoosier Southern Rail are done, and that grant is pending. And 8.1 is a very large bridge, and with it spanning the river, it's expensive. But we've written that grant, and we're seeking $4.5 million. And the local match is $1.1 million. So it's about an 80-20 grant.
And we're working with the Perry County Port Authority on that project, and it is pending, and we hope to hear before the end of the year on that one. And then the next one is improvements at the Tell City Pool, a land and water conservation fund grant, and that was awarded. And the engineer right now is preparing the plans and specs to improve not only the pool, but splash pad and the pool room features. So that's what makes up the 2020. So you can see how it fluctuates with projects that come in. We are on the final stages of port improvements, rail improvements. There's a bunch of spurs that were added along Hoosier Southern Rail that are nearing completion. And then there was a big water line project to support Wapaka that's wrapped up as well. So we're finishing that project. And then if you turn to page 9, what do we think we'll be doing in 2021? In addition to the EDA planning grant and additional funds from NDOT for keep doing traffic counts, Tell City would like to have a comprehensive plan completed, and we'll be working on applying for funding for that. They're also working right now with a engineering firm to make improvements with the Tell City utility departments, some pumping near the flood wall, and but the preliminary engineering report is underway at this time. Can Clay, we've had the environmental assessments complete on there, and now we're working with the city to do some cleanup activities. The Rome Courthouse, the historic preservation, we've done the planning grant, and we know what construction needs to be done, as well as the next item, the Cannleton Gym. Both planning grants are done, and we know the construction items, but the grants, they go through a public facilities program, and both of those programs are on delay until 2021 because the monies were redirected to support COVID activities. And then we are working with the Perry County Development Corporation for Innovation Center in the former Swiss Plywood, and looking at trying to find funding for that. And then at Riverview, the industrial park there, they're looking at 2 new pads for development to bring in growth there at Riverview Industrial Park. So that's, and things come up in between there, but those are ones where we know that we'll be working on. And so we thoroughly appreciate Perry County being a part of Indiana 15, the partnership we've had since 1970. We've been since 1973, so we're close to getting close to 50 years. And it's been a wonderful partnership, and we enjoy serving Perry County.
Thank you.
Thank you
Any
very much.
questions?
Yes.
Thank you.
We don't have anyone else, do we? No, that's you reading.
I don't think so. Yep, here for that. We've been playing the games in that couch, haven't we?
Okay, now we will have the first reading of the 2021 budget request. I'll begin with Clerk of Circuit Court, $194,541. County Auditor, $185,236. Treasurer, $122,025. Recorder, $101,152. County Sheriff, $559,044. County Surveyor, $9,898. County Coroner, $75,613. County Assessor, $122,991. Prosecuting Attorney, $72,476. County Extension Service, $133,380. Veterans Service, $31,317. County Council, $40,818. County Election Board, $21,540. County Commissioners, $2,209,593. Animal Shelter, $35,000. Planning and Zoning, $15,700. Courthouse, $132,128. Circuit Court, $606,195. Emergency management, $139,901. Jail, $527,794. 4G child support, $104,669. Soil conservation, $36,333. Parks and recreation, $154,608. For a total of county general of $5,631,952. Okay, continuing on, we have Health Department Fund, $284,623. Cumulative Bridge Fund, $306,700. Property Reassessment 2015, $183,752. Cumulative Capital Development, $218,422. Local Income Tax Special Legislation Detention Center, $933,000. Clerk's Record Perpetuation Circuit Court, $4,400. Sales Disclosure, County Share Assessor, $500. Emergency Planning, Right to Know, $3,967. Enhanced Access, Recorder, $16,452. Identification Security Protection, Recorder, $2,700. Local Road and Street, $443,767. Then Local Income Tax Public Safety County Share, we have Sheriff, $272,450. Commissioners, $535,375. Jail, $233,023. Highway Restricted Administration, $62,707. Highway Restricted Maintenance and Repair, $459,871. Highway Restricted General and Undistributed, $325,732. Highway Administration, $113,975. Highway Maintenance and Repair, $304,977. Highway General and Undistributed, $809,015. Plat Book Fund, County Auditor, $4,800. Riverboat County Share, we have Commissioners, $9,400. Courthouse, $20,000. Sex and Violent Offender Administration Sheriff, $1,450. Supplemental Public Defender Circuit Court, $3,950. Coroner Perpetuation Surveyor, $5,000. County Elected Official Training Clerk, $600. County Elected Official Training Auditor, $600. County Elected Official Training Treasurer, $600. County Elected Official Training Recorder, $600. County Elected Official Training Surveyor, $600. Statewide 911, $283,321. Supplemental Adult Probation Circuit Court, $74,669. Jury fee, $3,000. Pretrial Diversion Prosecuting Attorney, $67,918. Surplus Surtax and Wheel Tax, $250,000. Jail Operations, $242,250. Inmate Housing Sheriff, $17,830. Inmate Housing Jail, $54,550. Then we have Perry County Recycling Management, $524,481. Perry County Airport Authority Fund, $48,905. And the Perry County Airport Authority Cumulative Building of $40,000.
You got it.
That's a total of $12,801,884.
What's that total again?
What the total?
Yeah, 12.
$12,801,884.
And we only have to cut 990,000.
I guess, is that it? I guess we need a,
We've got a couple announcements.
oh, we do? Oh, yeah, we do. What'd I do with that?
There's mine if you.
All-day budget meetings, September 22nd, 23rd, and 24th at the Armory Annex at 8 a.m. I'm hoping the 24th, that's not gonna be an all-day thing.
I hope not.
I can see the 22nd and 23rd, but I'm hoping the 24th is just an hour, so.
Yeah, hopefully.
Then we have our regular meeting that evening. No, that's
Yes,
wrong, the 24th.
That is wrong, sorry.
We have a regular September monthly meeting on Thursday, September 24th at 5 o'clock. So I know we have to be done at 5 o'clock on Thursday. But normally it doesn't. Hopefully we can get, if someone wants to, can attend all 3 days, it's most important, I think, to try to attend the first 2 days rather than wait and attend the third day, because that's where most of the budget crunching is occurring, is those first 2 days.
Yeah, because if not, I'm really crunching on that
Yeah.
day.
But anyway, if no one has anything else, I think I would entertain a motion for adjournment.
I'll make a motion to adjourn.
I'll second it.
All those in favor, signify by saying aye.
Aye.
Motion carries 7-0.
Thank goodness.
Everybody wants money.
Well, the best part is you was reading through those numbers and I couldn't flip my pages and I kept wanting to lick my fingers.